Vanakkam, good morning. In this video, we are going to discuss about the vomiting. Vomiting is the important topic in gastrointestinal physiology. Vomiting is forceful expulsion of content from stomach and intestine. So the vomiting is controlled by the vomiting center. It is located in the reticular formation of the medulla oblongata near the vagus nuclei. This is stimulated by directly raised intracranial pressure. It affects the medulla oblongata, it stimulates the vomiting, and the afferent coming from the sympathetic and vagus nerve from the stomach and intestine. The stomach and duodenum contains the more number of the 5 hydroxytryptamine receptor, 5 hydroxytryptamine receptors that stimulated by the local irritants like drugs, viruses, radiation, bacteria, copper sulfate, and cytotoxic agents. These stimulate the vomiting center. These stimulate the 5-hydroxytryptamine receptor that send the impulse to the sympathetic vagus to the vomiting center. See, this is the sympathetic fibers. This is the vagus. Both are sympathetic going through the spinal cord to the vomiting center. Vagus directly stimulate the vomiting center. These are the afferents. And vestibular nuclei and irritation of the throat by the touch receptor also directly stimulate the vomiting center. Vomiting center having the afferent impulse from the higher center like diencephalon and limbic system. Diencephalon and limbic system. These stimulated by the nauseating smell and sickening sights. Sickening sights means the bad sights, and memory of the nauseating vomiting. Memory of previous vomiting sensation and nauseating sensation also stimulate the vomiting. Chemoreceptor trigger zone play the important role in the vomiting. This is a chemoreceptor trigger zone. This is located in the area postrema in the floor of the lateral wall of the fourth ventricle. It is located outside the blood-brain barrier. So these are easily affected by the emetic substances like apomorphine and emetin, digitalis, glucosides, increased urea level in the blood, that is uremia, and radiation exposures also stimulating the chemoreceptor trigger zone, that is also stimulate the vomiting center. It produces vomiting through efferent fibers. The vomiting is occur through the activation of the efferent fibers. The efferent is passing through the 5th cranial nerve, trigeminal nerve, and 7th cranial nerve, facial nerve, 9th cranial nerve, glossopharyngeal nerve, 10th cranial nerve, vagus nerve, 12th cranial nerve is hypoglossal nerve. This is supplied to the abdominal, thoracic, oral muscles, and gastric, stomach, and duodenum. During the pre-ejection phase, the retroperistalsis occur in the stomach, and reverse peristalsis, and increased salivation and feeling of the nausea sensation occur. And during the retching phase, what happened? The closure of the clot is occur, and Abdominal muscles are contracted and diaphragm is descent down. This is favor for the retching phase. During the ejection phase, the abdominal muscle is contracted further and gastric contents is moved outwards from the mouth due to the increased pulmonary pressure, intrapulmonary pressure, due to the descent of the diaphragm, compress the abdominal wall and increase the intraoral pressure, everything. Eject the abdominal and gastric and intestinal contents. The fast expulsion of the gastric and intestinal contents outward through the mouth. So vomiting. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.